Hi, I'm Janice Brown, a physician and physical medicine rehab specialist. I'll be joining SciMed Health on May 3rd and offering pain management as well as acupuncture. And I also do functional medicine, so I'll be incorporating functional medicine into the practice and providing that to patients so that way I can improve their overall health and also decrease their pain. Oh my gosh, since I was 5. Yeah, since I was 5 years old. I know it's kind of weird, but since I was 5, and not sure what happened or where the idea came from. There's a possibility I could have been influenced by my pediatrician, but it was 5 that I remember. So I don't like to think of physical medicine or rehab just as a pain management physician. We don't do just pain management. We do multiple other things. Um, so I like to think of us as the field itself as a field of medicine that focuses on improving patients' function. So in terms of pain management, it's what we're trained in. Unfortunately, there's a lot of people who suffer from pain, and so we sort of have taken on that role of managing people's pain. And as a specialty, we probably do it the best. Musculoskeletal problems, whether it's in the joints, the shoulder, knee, hips, back. Um, I work with people who may have, like, just in terms of my training, people who have had deficiencies in certain vitamins, nutrients, and so forth. I can, kind of figure that out and, work with them. But pretty much any kind of musculoskeletal diseases, a lot of neurological cases. I do spasticity management, which is for a lot of people with spinal cord as well as traumatic brain injury and stroke. Acupuncture just makes sense in terms of just understanding um, how the body works. It's just not putting needles in, but you also have to understand and diagnose the different disease processes. Um, so you look at the whole person and you think about what what is it that their symptoms. How can we classify the symptoms, and to which organ system does those symptoms pertain to? And then therefore we can try to figure out exactly what's going on. And then the acupuncture treatment itself is determined by that information. So for me, it just made sense. It was just something that I was comfortable with, that I said was going to be a great tool. And so in residency, I actually signed up for the course. It's the Helms Institute. It's a course designed specifically for physicians. And so I signed up for it and I just did it, and I started a practice. Really big exercise person, so I do any and everything. So yoga, swimming, biking, running, weight training, but pretty much like anything. So I enjoy working out, I enjoy moving, I enjoy spending time with my family. That's one of the draws for coming to Ocala. My mom and my sister lives here, so we're gonna put roots down here. So I think for me, just spending time outside, like in a place like this, it was like, now it's nice and sunny and I'm feeling warm. But anyway, it's like just being outside and walking with nature, going to the beach. I try to make people feel comfortable because first and foremost, I always remember that we're humans. Just because I'm a physician does not put me on a pedestal or make me any different than anyone. So for me, it's really important to make my patients feel comfortable, because by them feeling comfortable, they can open up and really talk and divulge what's going on. Because as any physician knows, if we don't know what's going on, we can't help you. We can't help that person. If they're afraid to talk, how am I going to help them? So I try to make people comfortable, and that way I try to get the information out. So I'm very nosy. I always tell my patients, especially in the hospital. But I tell them, like, I'm nosy. You know, I want to find out what's going on, so I'm going to ask. So